Thank you so much, both of you, and welcome everybody. Happy New Year to you all. I hope you all are doing happy and a healthy day to day, and doing really well as well. Mm. In Delhi, the weather is not quite suitable. It's rainy and it's cold, so bandwidth is not doing well. So I might have to like shut my camera in between if there is some trouble with the network. But let's continue our session today. So let's see what happens. I think already Shri and may I know your name, please?
I'm Sinia.
Sinia, hi, nice to meet
Hello.
you. It's the first time we are meeting. My name is Preeti.
No, we met the day before.
We did in the meeting.
Yes, you were traveling on bus
Oh,
on a
I
Zoom
did not
meeting.
register.
Okay.
Bad with names and identities. I'm really sorry about that.
Okay.
So nice to see both of you. Uh, Today the session is quite serious. It's about suicide risk assessment. So we're going to have long discussion and some serious discussions, but there'll be interactions with you in between. I might ask a few questions and you may ask a few questions to me as well. Do bear in mind that this session, since all of you belong to different fields, will be a broader perspective with a narrow lens specifically to prevent suicide and identify the warning signs around you, the people around you, for the patients that you meet or people that you interact with. So do keep in mind that. But if you have any specific concerns and specific questions, please go ahead and ask. I welcome all of you to do that. Do use the chat as much as possible. That's from my end. Anything else, Shri, that you'd like to add?
No, definitely not. You have covered all the aspects.
All right. Am I audible properly, or is there
Till now,
audio?
it is perfect. We are good to go.
Okay, great. So I'll just share my screen. We have about 34 participants. Are we expecting more?
No, average would be this only. We can start.
Okay, so I'll be sharing my screen with you all. And basically, I prepared 2 slides for today. One was just an overview of suicide and what it is about, what is the description, what is the current definition that we use for this, very logistical aspects of suicide profile. Then we'll be heading towards another slide that I'll be showing you guys. I'll discuss it in a moment. Let me know in between if you have any questions regarding this. So okay, so this is just an overview. It's sort of a say a description, definition, context, and content that is merged into one, prepared for your better understanding of what this particular topic is. And it may sound very general to you all, but suicide in itself has become like an epidemic in our society. Specifically when we talk about the young generation today, when you see the statistics, they're horrifying, which currently we don't have particularly a band-aid for. Like, for example, when you do immediate intervention for something, we don't have that because structurally and systematically we have built our societies, our education system, and the social interactions like media and platforms like that, as such that it's very difficult to reach out to the population which is suffering. So in keeping in mind, let's move on to the next slide, the description and everything. I'll just, are you able to see it, everyone?
Yes.
Yes.
Great. So society in general defines suicide or stereotypes suicide as something that, oh, the person has lost all hope or strength to continue with the life that they were having, or they were running away from the difficulties of life. But that's not particularly so, which we'll learn in the later in the slide that we'll be going to. So suicide is defined as an act to kill oneself or take one's own life. That's the simple meaning of that. Suicide, when completed, we don't refer to it as a successful suicide. We refer to it as an act of intentionally causing harm or causing one's own death. Now, attempted suicide is an attempt to take one's life that does not end in death, rather in self-injury. So that is completely different. So when you use the term attempted suicide, it is clinically referring to an attempt made or a try made to injure oneself. So self-injury is also something that has to be taken literally very seriously when somebody reports it. So in usual terms, we say it as self-harm, right? Assisted suicide is a very controversial and again, an in-depth topic that needs to be discussed. It talks about how people around one person or specifically targeted individuals are motivated to self-harm and even to attempt suicide and then commit suicide. So bear in mind the differences are attempted suicide and committed suicide, right? So there is a difference. Self-harm, self-injury. Again, if you attempt self-harm and self-injury, but it is assisted by somebody else or motivated or enhanced efforts by somebody else, it has legal repercussions in so again, legalities differ in each country, but in India, suicide is illegal, so is assisted suicide and attempted suicide. So it has legal repercussions. I do not know about other countries as much, but in our legal system, although reported very less, it does create some sort of, documented consequential reports from medical perspective as well as administrative perspective, and the legal forces that we have, like police and other legal forces involved, including the social workers. So we have to report it. It is mandatory. Suicide is the 10th leading cause of death worldwide, and India has the highest suicide rates in South Asian region, followed by Japan, Bangladesh, Korea, and Singapore. So now, countries which have less data doesn't mean that they don't have a problem. Sometimes these things are not reported either by family or by individuals, and is quite often hidden just because of the attached shame to this particular topic. So it's in Asia particularly is quite a problem these days. So far, any questions on this slide? Anything that you'd like to get clarified over? Okay, so what are the leading signs? We'll move on to this to discuss about it. What are the leading signs that you can see of your head? Like immediately you can notice it in individuals. One is the burden. So people usually talk about how depression leads to suicide, or how anxiety disorders or mental health issues particularly lead to suicide. But there are many aspects when the decision or the attempt or the trial that goes into suicide or self-harm comes. There could be many reasons for it. It can be caused by impulsivity, impulsive decision making, or say trauma or grief, or even a diagnosis of chronic illness can immediately motivate or push a person towards taking this step. Mr. Shiv Kumar Shnath has shared that they have started a suicide prevention helpline in Vijayapura following second COVID wave. So there are issues. Okay, Mr. Vishwanath, I'd welcome you to open your mic and talk about it, because I do not understand the context you're talking about. You started it, now there is some trouble running it because of an unfortunate accident. So are you asking for help from mental health professionals here, or are you just stating it as a fact?
He is bedridden now. Can't talk.
Okay,
So
okay.
sorry. So sorry to hear that, Mr. Shiv Kumar. We do hope that things get well soon, and we are sure that from Palem India, we are there to support you as good as we can. Right, Preeti?
Absolutely, we are all there for you. And in fact, Pallium India itself runs a suicide helpline. Not exactly a suicide helpline. It is a emotional distress support helpline called Sukh. It is for grief and trauma, but we do direct people towards suicide helplines, which are run by the government of India and NIMHANS Hospital. So we would like to help if there's something that we can do, and we can talk about it maybe once you're in a better condition.
Sure, Mr. Shivkumar, we completely do understand your that passion to help people out there, and we are sure that yes, things would be fine soon. We do pray for that, and we will definitely get in touch once things are fine from your end. We can continue with it.
Absolutely. So let's talk about burden. So burden could be anything from emotional distress, trauma, grief, responsibilities, or even everyday life. For some people, going through day-to-day chores also is a very big burden on them, especially when we talk about persons with disability who have not gotten the correct interventions in their life or education in their life. They are they feel the burden of even simple daily chores of picking up or washing laundry burdensome. So support, if there is no particular support system or the ecosystem is not very supportive, a person could feel the burden of their life and can just think that, oh, it would be just better to take this step. Abuse is again a very, very say leading sign to a person thinking, okay, I'm done with this and I cannot take it anymore, right? So it's serious, and I'm not just brushing it off. Abuses, many types of abuses are there. You all need to just sit down one time and just look at the different types of abuses a person could go through. And there is a particular slide made by WHO on that. I'd welcome you all to please go to the website and see. Abuses could be related to physical abuse, sexual abuse, mental, emotional, and there are other kinds of abuses like financial and fiscal problems that a person suffers from deliberately caused by somebody else. So self-loathing is another leading sign. Self-loathing is a person talking about themselves in a very negative way, or assigning oneself negative terms that that clearly undermines their self-esteem and confidence. So it could be very subtle also. A person could say, oh, I'm not really very good at this, or every time saying that, oh, I'm not good at choosing, ordering, or eating, I'm sorry, saying sorry again and again for no fault of theirs. So this is something that can easily be identified. Abuse is something that is difficult to identify, which is mostly a person keeps to oneself due to shame and trauma attached to it. So this is something that you need to learn through educating yourself and being aware about it, but also through observing people around you, because abuse could be very subtle, present in your house itself. And it is just a simply speaking, when you are, say, when you are undermining somebody's dignity, or when you are targeting somebody for something, or when you are seeing somebody being I'm not getting the correct word for it. If you are, I welcome you. I just mean to say that when somebody's rights are limited by someone else, so abuse is one of those.
Binding somebody's hands when they were supposed to fly high, like.
Exactly, something like that. Yes, absolutely. Limiting their opportunities and rights to achieve something. So that also comes into abuse and bullying. So that's something that you need to learn and educate yourself more on, because it's a broader and huge subject to learn about. Hopelessness, again, it's something that is very visible on humans. It could be emotionally, somebody's portraying or projecting hopelessness in their life. It could be about their career. It could be related to their own psychological condition. It could be related to their physical well-being, anything. When they're portraying hopelessness, you just need to understand the severity of it. So even if it is mild, obviously the support is required, and one good word can, change a person's life. So just make sure that when you're listening to somebody, that's communication is very important. When you're listening to somebody, and when you're observing and identifying any of these signs, you have to be present as a supportive system to them, even if you're a stranger, because that's very important. Because sometimes when we talk about isolation here, when we talk about loneliness and lonesomeness, saying that as a stranger also you are there for that person and you respect them as a human being is enough for that person to understand their worthiness, right? So when somebody is feeling worthless, they think about taking their life. But once validated, once understood, once listened to, could change the whole course of action for them. So these signs you need to learn about and understand, and in a more detailed manner, for you to understand how a person could take a decision towards suicide. I'll move on if nothing else on this. If you want to ask any question, please leave it in chat. I agree with her, Preet, infringement of boundaries. Definitely. Okay. Situational causes of all the leading signs that you saw above. It could include situational conditions, for example, financial issues or family problems. It could be related to the person's intrapersonal or interpersonal relationships, and financial conditions in the family or their own financial situations, where, say, for example, a housewife takes a decision to harm oneself because she doesn't have the say in financial decisions in the family, because she's not able to make even the little financial decision to buy herself, say something like a cake or coffee, So, and these do exist in our ecosystem. Some of the housewives do not have capacity or even right to make decision on that, what to buy and what not to buy. Then this is just a mere example. There are many other intrapersonal, again, interpersonal relationships and intrapersonal relationships. It could be office related, or it could be, outside the immediate family and inside the immediate family that you are living with. So a person's husband preventing them from making financial decisions, or a wife demanding more financial care from her husband, also depicts relationship in issues like personal relationship issues or spousal relationship problems, which could create depressive environment at home and particularly lead to depression in one of the spouses. That could again lead to self-harm and suicide. So it really depends where and how a situation could go, but reading the situation right is something that you need to be more, vigilant over. So once once you meet a patient, for example, you would be able to determine and observe their financial situation, the dynamic between the person who brought them to you and the condition that the person faces in terms of making a decision. So you would be able to tell whether a patient who's coming to you is able to make their own decisions regarding finances and regarding the relationship too. So this is something that's very, once you can observe it, it's very apparent. It's a learned thing, so you might have to learn this slowly.
So
Mental health,
Harpreet adds dowry demands.
yes, it's one of them. So it comes under abuses. Dowry demands basically comes under abuses, and it's a cultural phenomena. But in Southeast Asia specifically, it is a very big issue. Again, mental health issues. Mental health issues doesn't specifically stem from the situations at home or are triggered by situations at home. They could also be triggered by physical condition or a one-time event in a person's life, which is a traumatic or horrifying experience for them. Or it could also stem from physical aspects. For example, them having phobia, general anxiety, or anything like that. And when a person is exposed to certain phenomena or stimuli continuously, it creates certain kind of burden and it creates certain kind of mentality, which again stems into anxiety and stress, over time turning into distress. And that's where a person goes into thinking about the worthiness of their life, right? So again, that balance has to be maintained, and you need to understand a person coming to you suffering from a certain problem or disease, for example, whether their condition mentally is only at the level of normal distress or is it something severe, right? So you need to understand the level of severity in a person's distress, because obviously when somebody is coming to you, and if you're a psychologist, social worker, medical professional, they're not coming to you in happy conditions, right? Even during pregnancy, a person could suffer from depression. So you need to be aware about how to distinguish that, and that has to be learned through risk assessment again. And for risk assessment, we have definite tools that tell us that, which we'll discuss later in our session today. Medical health issues, again, obvious reason for the signs that you've learned earlier. Medical health issues, chronic or even non-chronic problems could create a lot of distress amongst one person. For example, if an individual has never suffered from any severe illnesses, say till 20 or 30 years old, they have not gone through any severe problems which made them bedridden, and suddenly they got jaundice, which made them stay at home for a longer duration of time and change the health aspect altogether for them, which made them change their lifestyle. It could be a very, very catastrophic problem for that individual, because earlier they have never faced it, and suddenly now they have to change their whole lifestyle because of this one disease that they got, and they may blame themselves or other people for it, right? And then self-loathing will start, and there are a lot of things that would lead to mental health issues and then to suicide. So medical health issues do have very much a huge contribution actually towards this kind of decision. Chronic health issues during the diagnosis itself, when doctor tells a patient about the say a non-communicable disease which is untreatable, right? So a person who has not even been prepared to hear that diagnosis and then get to hear it, and then not getting the proper support that they are required, they may take the decision immediately without even a second thought. For example, returning from hospital, they see a car and they jump in front of it because they think that the life is already over because of the diagnosis. So it's very important to understand a person's mental state before you tell them anything, or before you may give them a decisive diagnosis for their life. So medical health issues, and then neglect. Neglect in children, often we see when they're neglected, their behavior changes and it becomes either attention seeking or completely like a cocoon. For example, they will be like a cocoon, they won't go out, they get antisocial, they have abusive behavior towards others and towards themselves also. They don't take themselves as seriously, and then typically do things which lead to suicide in childhood, adolescent, or even later years in their life. So healthy, functional individuals, it's a hard thing to do, but it is possible with proper support and awareness and identification of these issues. So if you have, regarding these slides that we discussed, if you have any questions or comments, please, you're welcome to do so now. Yes, a lot of people have written down issues that could lead to a person making a decision over suicide.
Excuse me, ma'am.
Yes, ma'am.
I would like to know the last point after the medical health issues. What was the last point for the causes? Neglect. Okay.
Yes.
Okay. Thank you.
All right, I'll stop share. If you have any other questions, please go ahead and ask. Okay, so we talked about suicide profile. Then now we'll talk about the prevention of suicide, and that we'll also learn about statistics and things like that. And I may be like boring you all to tears in this section, but please bear with me. Again, this is a broader perspective, so do your own research. I recommend that, because all of you are from a different, I think from different regions and countries as well. So please do your own research about these things as well. So now suicide is basically, it's not just a personal tragedy, but it has ripple effect. So a person, for example, if they're a part of a family unit, be it say a family of 4 or a family of 7, it will have a ripple effect. So for example, statistics tells us that if a family of 5 generations, say, has a suicide in the first generation, will also have a suicide in their 3rd generation. So this research was conducted by a Western author. It is, I think, I read it in Outliers. It's a book called Outliers, where there are a lot of researches where people talk about successful individuals and the failures in life. So you can read it and you can see how this affects, but generally it is understood in research and medical community as well, that if a family is suffering from, say, mental health issue generation to generation, they might have a problem or a case of suicide in their history. So that's very important to, when you're especially assessing a person's mental well-being, it's important to take history as well. Is my voice echoing or am I clear?
You're clear, ma'am.
So when we say here, our country, I'm talking about India. Every year, more than 100,000 people commit suicide in our country. There are various causes of suicide, including career problems, sense of isolation, abuse, violence, family problems, mental disorders, addiction, to financial loss, to chronic pain. But bear in mind that this was made in 2019, and now we have COVID, which is pandemic aspect of it included in that. So suicide rates have jumped to a different high. They're not reported because some of the members, for example, some families have lost a lot of their members, and then a person who's left alone commits suicide, right? So these kind of cases are coming to light quite late. So they're being reported late. So we don't have the statistics right now because it's very recent thing. So keep an eye on the news reports for the trends of mental health and social issues. So you will get to know where we're heading and how research will be reflecting these problems in the next 2 or 3 years. So NCRB is just one of those organizations that collects public data in India. So I think that every country has such organization. So please go to your public portals and get the data of I do not know whether, because this is a police recorded suicide cases that we are showing here, because we have a legal framework for reporting suicide and things, but every country doesn't have that. So your country probably will have a different way of gathering such data and reporting it. WHO website also has such data for each country, about 200 or so. So death rates in India is highest in the world. It is because of the social aspect of it, cultural aspects, as well as age related issues, because there's so much pressure and so much change occurring simultaneously in every aspect of life. So it's very important to cue in those factors when you're talking about the rates of suicide in a country. Now, terms that matter. Language is a very, very important thing, which we have learned recently. 5 years ago, when I was studying and training in psychology, and when I was working in hospitals, these things, these words didn't really come up. They just had very blunt terms for these things, and they used they use them quite often. For example, successful suicide or failed suicide. These things were used quite often and very in a usual manner, right? But nowadays, when we are training or when we are looking at these things, we have a particular framework for language of reporting this, or language of even orienting a patient over it. So suicide is when people harm themselves with the goal of ending their life and they die as a result. A suicide attempt is when people harm themselves with the goal of ending their life, but they do not die. So sometimes people refer to it as failed suicides, but now we say it as unsuccessful attempt to end one's life. So why language matters is that sorry, but the light is gone out. Why terms matter? Because language has a very deep rooted effect in our thought process, right? When I was talking about the ripple effect of suicide, every member of family getting affected by one suicide, and it is not just the immediate family that suffers, it is the friends and their family members. It is the known people in the classmates and their family members. So one suicide affects a lot of people. Similarly, language affects when a person hears it and reiterates to somebody else, right? So when a word has negative connotation to it, it impacts our thought process and makes more negative thought come out. So it's best to neutralize that effect. Why? Because say COVID, right? Take an example, COVID cases in the country have increased a lot. Everywhere you will see COVID-19 has done this, COVID-19 has done that. When you read news, it is more blunt, harsh language that is coming to you with very volatile scenery or pictures or videos of that. Then you come to your WhatsApp and you see the same thing in messages and statuses, and even the personalized messages coming from friends of yours. Even ask for help, right? When they ask for help, they use the same language. So this sort of thing has brought in another kind of stress on people. So if I tell you that, okay, due to COVID-19, the impact in our country has increased to another level and our economy has had a downturn effect, that gives you a neutralized effect of understanding, rather than me saying because of COVID-19, our financial condition has gone down, right? The language is not really, it's not really volatile or harsh, but the deduction, although same, would have different impact on your thought process. Same for, say you got a news of somebody passing away due to age related issues, right? And when somebody says, oh, he reached 90 and died, you will have different kind of thought process with the both the sentences that were said to you. So that is why language is important in understanding these terms as well. When you say committing suicide or successful suicide or failed suicide, when referring to such things, these have negative connotations. So what you may say is that a person attempted to self-injure or attempted to kill themselves. That has no successful or failed attempt attached to it, which does not quantify or measure one's attempt, right? So this is something that you need to think about and use when you're talking to other people. Now, understanding the warning signs, we learned the warning signs earlier. Now it's important to understand them further. Here we're talking about mental health signs more, because other signs you have already learned about. Looking for a way to access lethal means. So if a person is Googling how to die, what injections could kill you, what medications could kill you, can one particular medicine harm you to death, or can this fertilizer take your life, these kind of things. Then if somebody is coming to you and ask, oh, if I take this medicine for a longer period of time or in this much quantity, what could happen, rather than asking you what are the side effects. I request Sangulata to please mute herself. Increased anger or rage. If you perceive somebody completely changed their behavioral patterns and are getting more annoyed or angry and suddenly fly into a rage because of little issues or small problems. It's a changed environment for them. There is something deeply wrong and you need to find out the reason for that, and you need to give your support. Extreme mood swings, expressing hopelessness, talking or posting about wanting to die, these are all warning signs. feeling like a burden, being isolated, feeling trapped or unbearable pain. Now, pain could be psychosomatic. It could be just, stimulated by mental health problems. It could also be physical pain from chronic illness or from trauma or accident. Increased substance abuse, addiction, making plans for suicide, or to get away from something, or to not face a mistake in life, or to not be able to get the support to face that problem, can make a person think about ending their life altogether. Because people, when they're in a situation, stuck in a situation, they don't think about, time passes slowly for them, so they don't think about giving it time or relaxing, or they become in panic and sometimes are very impulsive. So for example, for this particular making plans for suicide, I'll give you an example. I got a case 2 years back. The pandemic had not started yet. I had this patient from a long time. He was doing quite well, and he was HIV positive from LGBTQI community. And he had 2 children, a very volatile relationship with his wife for obvious reasons. And his wife, being a mental health patient, she suffered from bipolar disorder. No support from other family members. They didn't even know about his situation, and he did not clarify himself to his wife before marriage also. So obviously he was suffering from a lot of problems and coming for counseling for these issues. He adapted well to the treatment of HIV and to the problems related to his issues with his wife. He came with his wife. They were doing not well exactly, but they were, say, adjusting towards the life that they're going to have. Then because they were not able to conclude, or because he was not able to handle her mental health issues as well as his own guilt and burden for making his wife vulnerable and getting married to her and then having children. One of his children were also HIV positive. So these were the stressors and factors within the family. And they both one day decided to get separated without a divorce. Then he made plans to go to America with his other partner, and whom he was not in touch with for a long time, but then he got into touch with her when he decided to separate. So he made plans to go to America to send both his children there as well, because he thought that it would be best for one of his child who was HIV positive to live in a country where the treatment is more better and available for HIV positive person, and there is no stereotypical or cultural issues in bringing up a child who's HIV positive. So thinking about all these aspects, he made the decision to go. Then suddenly the pandemic hit and he couldn't go. And I learned about his suicide a month later, like in March, the lockdown happened, and in May, he took the step of doing suicide. So it was quite shocking, because one of the reasons was he, first of all, made himself quite isolated. He was coming for counseling quite regularly, but then he stopped, and all the attempts to reach out to him were also blocked. His wife also were not taking it very well. She stopped her medication, so they were having a lot of issues at home, fighting frequently. The children were too small to understand what is happening, 5 and 3 years old. So say a toddler and 5-year-old can't really navigate this complicated situation. So I don't have all the details exactly what occurred, but I do know that if they had a support system within their family in this particular situation, the family members were living right below their floor. So if they had a particular support system, this could be avoided. But the family now blames themselves for his decisions, which again cannot be, put particularly on them, because when you take impulsive decisions in life, you as an adult are responsible for them, although it could be prevented from many different factors, including from support system to medical professionals helping him out of it, or say more follow-ups from our end also. There could be many things, but the decision at the end was of on the individual, right? So blame, although cannot be shifted to anybody else, it is a collective blame. We all have to take it, and we all have to understand that in that person's situation, we all had a role to play, because he made a particular decisions and could not come out of his own shell because he was not comfortable, or he was not given the safe space in our society to do so, right? So these kind of issues have a very critical way of making us understand how complicated these issues could be. And we can have thousands of opinions about his decisions and his life, but the responsibility on us cannot be denied either. So it's always better to prevent such things and understand the warning signs and understand the deep-rooted aspects in each sign than to later hear about such cases and present our own opinions. One important note, I hope that you all read, while the link between suicide and mental disorders, in particular depression and alcohol use, is well established in high-income countries, many suicides happen impulsively in moment of crisis with a breakdown in the ability to deal with life stresses. It could be financial problems, relationship breakup, or chronic pain and illness. But what mainly this note is saying is that coping mechanism or defense mechanism of an individual when they suffer from some particular thing and take a decision or make plans impulsively to end their life have a lot more role to play. So when these days you're learning about happiness curriculum in Indian schools, or when you're learning about coping classes or life skill classes in Indian primary schools, high schools and colleges, soft skill sessions in universities, when you're hearing about those, they have a huge role to make those individuals be equipped and well managed in terms of dealing with such crises and problems. For COVID, nobody was well prepared, but people who were aware about mental health issues because of isolation had some aspect of defense and some chances of defending themselves from it, right? So let's move on to another slide. If you have any questions, please put them in the chat box. Harpreet says, possibly if he was not forced into marriage with a woman due to social norms, also would not have pushed him into this. I agree completely. How about telling tried to commit suicide? Sangam Chin. Yes, you can use that term, tried to commit suicide. But I'd suggest that if you can say that tried to self-injure would be a better term, because suicide, see, when I say about language, I'm not only talking about the medical community, I'm also talking about the family. So if somebody is coming with attempted suicide to you, basically who will bring you that person is the person's relatives or friends, right? So when you are saying committed suicide, it's going to their ears also. You would like to avoid that, basically, and so you can use this term after orienting and counseling them better on it, and sort of neutralize the harsher effects of this term. Now, why are there so many suicides in India? This question will give you a lot of answers, and one of them is crop damaging temperatures increases suicide rates in India. Recently, we had floods in Assam. We had floods in Bihar, and many other places in South. Kerala recently also had floods. But in places where people depend, or people's lifestyle and earnings depend on crops, and they're damaged either by temperature or natural disasters like floods, it has a huge impact on their decisions of continuing with this life or not continuing with this life, because aid or government aid specifically does not reach to them on time. They are also not well learned or educated to understand that when something like this happen, usually government provides support and they have to wait for it. Sometimes they understand it but are not in a condition to wait because they are already submerged into debt for that particular season, because that's how a farmer lives. They take debt. Small farmers, they take debt. They depend on the crop for the season to pay it off and to earn a bit of amount, and then for the next year also they have to take debt, and again it's a cycle that they have to follow. So it's such a huge country. Every year in one of the states you would hear that floods have come or the crops were damaged. Maharashtra is one of the most affected states where such things happen quite often. Andhra Pradesh is also one of them. Odisha was one of them, but I'd like you to study that state and understand how government was able to deal with such things and how they changed the scenario from from one of the poorest states in India to now one of the most or fastest developing states in terms of agriculture. So I'd like to study that myself also, but I am just recommending if you guys can as well. And if you're from a different country, please see one province from other, how it differs and how socially people live and what kind of impact their lifestyles has or the natural disasters have on their decision making in terms of suicide. Yes, Harpreet, I agree with that as well. Now, prevention we're talking about. We learned about warning signs. We learned about what all leads to decision of suicide. But what can we do as professionals, mental health professionals, medical professionals, and social professionals? What can we do? So one technique is ADAPT, ADDPT, which is avert, delegate, delay, prevent, track. Now, as a mental health professional, I wouldn't recommend for you to, wake up at 1 o'clock in the night and take a call every single time. It is not possible as an individual to be available to patients at that time when you're resting or when you have like family time. But what I want you to do is have a ringtone for particular cases where you understand that it could happen impulsively. And even promote and just motivate your patients to call you on daytime when you're working. However, definitely make sure that they know where to reach when they're thinking about suicide or making plans for suicide. It has to be in orientation for each patient so that they can help other people as well. Then make sure that, for example, volatile patients or patients with history of self-injury and patients with deeply affected mental health well-being, or going the people who are going through trauma, for them you need to have a different ringtone in your phone so that when it rings you know who's calling and why it is important to take that call, because even your 1 or 2 minute could save it. That's where avert will come. Avert is basically just averting that person from making that impulsive decision, right? It could also have a long-term thing. Somebody raised their hand, I'm sorry. Please, you can unmute yourself and speak. No? All right. Please leave a message in the chat if you want to speak, or you can just unmute yourself and get into a discussion with me. That's completely fine, or ask your question. So averting in long term also means when you're meeting a person, assessing them on the current condition, their current condition, orientation, and mindscape. You need to understand the history of the family. You need to understand the history of that patient to know whether they're thinking about suicide or not, or what kind of mental health condition they have currently. And averting that from happening is basically making them understand that they're worthy of your time. And you as a person are validating them as human beings. So they're comfortable and have a safe space. Again, I'll reiterate it, safe space to talk about these things. A doctor on an average has less than 10 minutes for a patient to diagnose, to understand the symptoms or physical aspects that they're coming to him for. But out of that 10 minutes, I'd just, if I may, if I could suggest that 1 minute to understand the mentality or mental condition of that patient at the moment. If you could, that will be really helpful, and your observations would go a long way in averting the damage that the person causes to themselves. Because one sympathetic word from a doctor could change a person's life, because when you're meeting a doctor, you actually keep them in a very high esteem. And although a doctor is busy every single day and every single moment, it just part of the job. It comes in it. So your self-care also matters. So for yourself also, you need to avert the damage to yourself. So how do you do that? You make sure that in the practicing, while practicing medical profession, you have your own personal space in life. When you're not practicing, you're not available. This is something that's very important, because out of say 40-hour shift, 48-hour shift, or 24-hour shift, when you get time to rest, and if it is not your training period, please rest, because you are also a person, and especially in times like COVID, you are one of the frontline workers, and it's important for your health to be better so that you can save 100 other people that may get damaged if you get damaged. So for yourself also, you need to understand that you need to prepare band-aid for yourself in crisis situations, and also in normal situation, you need your rest and space. How you do it is completely up to you. You can design it. Obviously, being a high intellect person, it's important to align your time that way. But I cannot really comment on it, because I do understand the nature of work in your line. Again, delegate, that's another term. If you're not a senior doctor, it's possible to delegate work. If you're a junior doctor, it's not possible to delegate work. Again, mental health professionals, due to confidentiality, most of the time you're not able to delegate the caseload, right? What I can tell you is referrals are something that you can use to delegate your work, right? And in terms of dealing with individuals who are suffering from, say, are going to do suicide, or you have assessed them on high risk of attempting suicide, you can delegate those cases to your colleagues if you're not able to handle them. And for the individual, you can make it possible for their support system to be there when you're not available as a support. So delegation is important. Making a roommate aware about the steps to take when there is distress, which is high distress, or when not to leave the person alone. These simple steps could make it possible for you to have lesser burden on yourself as a professional. Orienting family on it, making sure that if it is a high risk case, how the bathroom should be, what things should be available, what things should be not available easily or accessible easily to that person. That's another thing that you need to tell them about. Delay. Now next is delay. Delay is basically just delaying the time or delaying the decision of the person. If a person is hell-bent, for example, in a case of mania, if a person is in a condition where the logic is not working, right? And in a case where the person is not in touch with reality and is suffering from psychosis, delay is something that would really help a lot, where you're talking to that person and you're just talking randomly if required. You're talking as much as possible or letting them talk as much as possible to delay until you get particular support, or a doctor who could inject them with relaxant, or a family member who could come and help them. You are delaying, right? And in general situations when people are planning suicide and things like that, saying that this year is horrible, they're not able to do this and that, you delay by saying that, okay, let's do this for 3 months and then see where we are at. Then again, next 3 months, you make another plan. You say, okay, for 1 month, let's see if this condition is still like that. You have decided to do this. Let's see what are the results of that. So this sort of thing could delay their decisions. And when time passes, the situation either could get worse or easier on the person. But according to that, you see how things are going, and then you can come to the next step, which is prevention. So prevention is something that's immediate. It has to be blunt. You cannot play with words here. It has to be very direct and straightforward. Specifically, when we are talking about prevention, we need to understand that in prevention, we haul up all our resources to save the person's life for the individual. We haul up the family, our staff, our workers, ourselves, and specifically when we're talking about suicide, confidentiality does not really matter in terms of legality. So if you have assessed a person on high risk of suicide, confidentiality clauses are not applicable. You can take your own decision, and they have to be logical decisions, and they have to be pragmatic in terms of implementation. So here you will decide whether to admit that person in the hospital or not, or whether the person is able to live on their own or not, or if they're able to take their own decisions logically or not. So awareness you need to test, and you need to again make decision on it. When you are done preventing, when the person is in a healthy condition or is manageable, and step by step, gradually they're getting back into their daily routine or lifestyle, or getting involved in their life in a better, healthier way and functioning better, you need to still track them. need to understand where they're at in their life. What are they thinking? Sometimes they may share things, sometimes they may not. So it's always better to have a backup with the family members and the friends and understand how they're doing in life and how they can also keep a track on their activities. So I hope this time I was able to explain clearly. If you have any questions regarding this, please go ahead and ask. Nothing? All right, so I'll move on ahead. What to do? What are the steps that you can take to prevent it and to track it, to keep a tab? Now, suicide is one of the most preventable issues amongst us. There are several steps that could be taken to as a measure to prevent it. One of them being not being fearful for inquiring about suicidal thoughts. Are you feeling suicidal? It's a very blunt question, and the person could say no, I'm not, but then they will be, it's an open-ended question. So they will be able to explain it and you'll be able to gauge what they're thinking. Keep a tab on everything that they're saying to you so that you know if something is flagged or something that needs to be flagged. Know what suicidal ideation sounds like. I'm not doing well these days. I think my life is not good. And then saying, what would happen if I end my life? These are just out loud thinking thoughts, basically, which a person says when they're in distress. So these are the ideations. Planning something also, again, is one step ahead of getting to suicide. Recognize and understand the nature of their impulsivity. So if a person is coming to you, being a social worker or a mental health professional or a doctor or nurse, you get to know how a person's behavior is, if they are of impulsive nature or not. Because once you deal with person for 10 minutes or maybe once or twice over, you're able to gauge their behavior pattern. And when you're able to gauge their behavior pattern, you will be able to understand if that person is capable of making impulsive decisions like suicide or self-harm or self-injury. Most common means of suicide for various stages of life. Ages particularly matter, like I said earlier. In India, the age 15 to 29 is more vulnerable to suicide. Now, if I can explain clearly, a 12-year-old child will not die by hanging. You will not hear more cases about it. What they do to die is cutting, taking medicines, or repeated self-harm through blades and things like that, sharp objects. So, or going to a train track, jumping in front of vehicles or jumping from buildings, things like that are common amongst children or adolescents. Drinking phenyl and harmful liquids at home is one of them as well. But for 29 years old or 30 years old, hanging is the most common cause of suicide. So what age a person is coming to you matters in terms of understanding what methods they can use to self-harm or attempt suicide. Have a crisis resources on hand, share them with your client and acquaintances. I said it earlier, I'm going to say it again. Every person who comes to you needs to know about suicide prevention, needs to know about what are the helplines available to them and what they can do. If they're illiterate, what they can do. If they're literate, what they can do. These things have to be told to the patient, and it really depends on your region and area. It does not depend. If I tell you there is a national suicide helpline, it is there, but for a person who's uneducated, it's useless because they will not be able to type in the number. So what they can do, who they can reach, what is the social ecosystem to prevent it. It matters a lot to be aware about these things. Be firm in your actions. It's important to know their family members, the clients, know-hows of how the social structure of the client's relationship. Then being firm in your action, making sure that you validate the concern of that patient, but being firm on your decision to help them and to make them understand that the step they're taking is not the resolution for their problems that they're seeking. So being firm is very important. Reward and punishment is one of the cognitive techniques used for particularly for children. And it's not about punishments in the sense of corporal punishments. It's more intellectual and related to play therapy, right? So don't think that we're talking about punishing them seriously. It is about reward and, again, controlling one aspect of behavioral crisis. Always take a psychoeducation and orientation at first approach. Top your clients and their families. So towards your clients specifically, when the family is coming along, and if it is related to mental health, or if you have observed distress which is severe, you need to tell them about suicide and the prevention of it, or self-harm and prevention of it. You need to make them aware that this is one of the issues. So even if, people always don't take serious stuff seriously at first attempt. But when something happens around them, they will be taking it more seriously. So when I say around them, it is also about news. One news could impact a household greatly. One of the examples being suicides of actors, for example. Being it Sushant Singh Rajput or Bobby, Parveen Bobby, and many other actors who have done it. It has impacted our social structure greatly. So this is something that you need to understand, that when you're orienting people, you need to make them understand that a person's steps or decision making does not depend on their financial situation or situational crisis as such, but impulsivity in general when they are in high distress, and that has to be controlled in certain ways. This data is of India only, so it's not really that relevant to you, and it's old, so not really relevant. But again, by implications, I mean statistics matter a lot to identify which population or which area is more vulnerable to suicide. It's important to see statistics and understand it. And especially the marginalized communities like LGBTQIA and women in India, or students, for example, particularly adolescents, they are more prone to suicide in urban areas, but in rural areas, men in agricultural societies are more prone to suicide. So this sort of conclusion or deductions can only be made by statistics, and that it differs from region to region. Thank you. I'll stop sharing this slide. If you have any questions, please ask. Go ahead and ask. And after that, we can discuss the risk assessment tools. Anything that you'd like to ask regarding the presentations, earlier presentation, or something that you want to comment on? No? All right. I think we have, how many minutes do we have, Shri?
10 more minutes, ma'am.
10 more minutes. Okay, so I'll quickly go through the assessment tools. So for everybody, I'd like to say that the risk assessment tools for suicide is available on WHO website as well as health website of your own country, particularly in Bangladesh Bangladesh and other countries like Myanmar. It's on the health ministry's website. It's there. You just need to find it. And if you're not able to find it, APA is American Psychological Association's website also has suicide risk screening tools. So in one of the tools I have found an IMH suicide screening tool, anything like particularly related to medical conditions or mental health conditions, you will be able to easily find these tools online. So don't ever panic if you don't have it available in your medical institution. It's available online, so do use it. And these are standard screening tools, questionnaires and surveys, so you don't have to worry about it. I'll just share my screen with you so you can just see. This is an NIMH tool for suicide risk screening. There are about 5 questions in it only. It's a small toolkit. So for any rapid, for example, if you're doing a camp or something, for quick assessment, it's easily available online. You can use it. In the past few weeks, have you wished you were dead? Yes or no? It's very easy. So it really depends on region to region. When you're, say, in a rural area doing a camp, you can easily translate it or get it translated because there are only 5 questions and they're very blunt questions. So it's easy to use, right? Then there is another one. It's a Colombian suicide severity rating scale. So this scale, this tool is just telling you about if a person has thoughts of suicide or has planned a suicide or has had a history of suicide in their family or not. But this particular toolkit tells you the severity of the situation a person is in, right? So risk assessment version, you can see it's 2008, still available online. You can get it easily. This is like a checklist. They talk about suicide and self-injury behavior in the past week. So if you want a detailed report, you can use this particular assessment tool. Actual suicide attempt, interrupted attempt, aborted attempt, other preparatory acts to kill oneself, all these categories. This is all about language. So if you understand, interrupted attempt could be anybody. So a person wanted to commit it, but somebody walked in, so it was interrupted and they did not finish the act. Then aborted attempt would be they wanted to do it, but something happened and they cancelled. Other preparatory acts to kill oneself, just planning and trying different methods to injure oneself. Sometimes self-injury is all about either attention seeking or some other mental health problem that they're suffering from and to relieve their anxiety. So you need to distinguish between self-injury, particularly for intending to do suicide, and just self-injury, injuring behavior in general. Suicide ideations, how severe were they? Activating events, what was the trigger? Treatment history, if they have had history of mental health treatment earlier or admission for suicide attempts earlier or not. Then other risk factors. One of the things that often psychiatrists ask a person is a report of lithium and a report of hormonal imbalance like thyroid and other such reports to understand if a person is how a person is faring, if a person is in depression or not, how severe their condition is. So it's important to, if you're a doctor, to give those tests if you have observed depressive symptoms in a person. Clinical status, if somebody has a diagnosis, psychiatric diagnosis. Protective factors and other protective factors. This is identifying the support system or the ecosystem that could support that person in prevention of suicide. This is a checklist. So just a descriptive portion they have given in case you want to include details or dates or specified timelines. Suicidal ideations, wish to be there known specific active suicidal thoughts. This is more into detail about the intensity of ideation or thought that they got or the planning that they were doing. So this is pretty detailed questionnaire. I will also share the link online with you. And it is, so again, some people talk about culture being a factor in testing and tools, but suicide, you can, for suicide risk assessment tools and severity assessment tools, you can use different toolkits depending on your own requirements, which are available online but are standardized. So you need to understand your own requirements, but you can use any of the tests. It doesn't specifically have to cater to one particular culture. For any detailed tests for diagnosis purpose specifically, that's where you need culturally appropriated or culturally suitable test for suicide risk assessment. That's about it from my end. If we can have a discussion if you like. And stop sharing. Your thought process, like what did we miss in this session? If you have some points to share, you're most welcome to do so. Please understand that I'm coming from a mental health perspective and social work perspective rather than medical one. So if something I have missed, go ahead and ask. Do give your feedback. Senia has shared link in the chat. All right, thank you so much. And back to you, Shri.
Thank you, Preeti ma'am, so much, because being your teammate, I do perfectly understand how busy schedule you might be having. So in spite of that, you agreed to give this cohort a time slot. Thank you so much for that. And I believe that this was indeed an eye-opening session for everyone out there, just like me. So, Sinia, over to you.
Thank you, ma'am. Thank you, Preeti ma'am. Thank you so much. Thank you for this wonderful section. Looking forward to have many sessions with you again. And thank you all. Kindly please send your feedbacks. The link is provided in your chat box and in your WhatsApp group too, because feedbacks means a lot to us and it helps us to improve very much. Thank you once again. Hope to see you all again on the next section. Thank you. And I'm leaving from this session along with Sri Priya ma'am. Thank you.
Take care, everyone. Bye-bye.